Hi, I'm Ken Lambrecht, President and CEO of Planned Parenthood of Greater Texas. Excited to share with you now a tour of one of our health centers. This is one of our family planning centers, providing birth control and other services that we'll talk about inside in a minute. It's similar to our health centers in El Paso, Dallas, Fort Worth, Waco, Paris, Tyler, and throughout our service area. Welcome to the lobby of this family planning health center. Patients would typically walk in after being called in from their cars in these days. Our waiting rooms are usually full pre-COVID, and now during this time, we're texting with our patients to keep everybody spatially distanced and safe. And as an essential, time-sensitive healthcare provider, our doors are open, and they're open to anyone and everyone who needs us. So join me as we walk into the area where we see our clinicians providing telehealth, and then we'll learn more about some of our other services. This area is primarily an area where our clinicians and our physicians work. In this specific area, we're also providing telehealth services. So our clinicians are able to meet with patients online. One of the biggest differentiators in care at Planned Parenthood and health centers like us is that we actually have our own pharmacy. So when patients have a sexually transmitted infection or symptoms of STIs, we can send them home with medications. And we can also treat their partners. What we've learned is removing barriers to care helps to keep individuals and communities healthy. Planned Parenthood has lab services in all of our health centers as well, providing everything from the flu vaccine to rapid HIV tests where individuals can get HIV results in less than 20 minutes. Throughout every one of our health centers, we're trying to make sure that every single person feels comfortable and safe and that they know that they can talk to us. So in the education rooms is where a lot of our health providers hear the most intimate details of somebody's life, things that they're worried about. And many tell us that they're afraid to talk to their providers because of experiences they've had with others. So it's where the cornerstone of our brand, non-judgmental care, listening with compassion, and caring no matter what comes through. Then when the patient moves on through care, they come into an exam room with one of our nurse practitioners or physician assistants or physicians. There's really nothing unique about our exam rooms. It's really the care that we provide here. It's non-judgmental, it's holistic, and it's meeting the patient where they are, whether it's talking about birth control options and their lifestyle and what's best to help them plan their families and space their children, or if they're frightened because they've been a victim of sexual assault. We know that there are health disparities, and what we do every single day is we try to remove the healthcare disparities that we can, providing access to all individuals without judgment so that they get the care that they need. We hope that you learned new information about Planned Parenthood and the services we provide, and most importantly, the patients we serve as we walk through the center today. And we could not do any of this without you. Our donors make this possible.